Well, thank you everyone for coming here today for our presentation. Just to introduce ourselves, I'm Natalie Oropeza, and I have Isabel and Valeria here with me on our project. We don't have anything to report. We did not receive any funding in the process of creating our project. And just a quick outline of what we're going to cover today is the ECHO Autismo history. Our project names the phases of our process of what brought us here today, and also our acknowledgements. So to get us going, I'd like to introduce Valeria to explain the history of ECHO model.
Hi everyone, I'm Valeria. I think before to start with the ECHO teams, we need to check the ECHO program history. And the acronym of ECHO means Extension for Community Healthcare Outcomes. And the ECHO program was created in 2023 by Dr. Sanjeev Arora. He is a liver disease specialist at the University of New Mexico. And he has this vision to the ECHO program to support clinicals to provide a high quality care to the patients where they live and when they need it, as the project ECHO model, like moving knowledge, not people. And this is a telementoring program to use video conference to reduce the health disparities. And it's a team of interdisciplinary experts in a topic, and the providers, the healthcare providers, that work in a collaborative way in this learning loop when they share knowledge and experience, and they do a brief presentation in a clinical case-based learning, and to share evidence-based practice in this case in autism care. And as you see the numbers in the bottom part, this ECHO program has been replicated across the United States, in many states, and globally. But if we start with ECHO autism, because this specialty started in Missouri in 2015, but here in ECHO autism at the UC Davis Mind Institute, it started in 2019, and it was established for professionals only. But the specialists asked if they can replicate this program for speaking Spanish providers. And then in 2021, ECHO Autismo in Spanish was created for professionals. And then in 2022, the ECHO Autism program opened for professionals and parents too, with the goal to increase the identification of autism symptoms and related comorbidities through the dissemination of evidence-based practices. This is the Mind Institute ECHO Autismo expert team. Our project primary aim was to evaluate the dissemination of resources shared with the professionals and families who attend the ECHO sessions. But our secondary aim is to create these resources, right? And systematize the dissemination. Also implement strategies to optimize the outreach and the attendance of the professional and family members.
So in our process, we looked at the needs, resource generation, implementation, and evaluation, and then we'll get to the summary. So in phase one of our project, we met with the ECHO Autismo team, and we discussed, what some of the things that we were looking to bring on extra to the team. We looked specifically at online resources because there is such limited evidence-based practices that are translated adequately in Spanish. So that is something that we heavily had to vet and search for. And unfortunately, we also found that a lot of these resources, were scrubbed from the internet because their funding was terminated. So I really wanted to highlight this and just how important this was for our process. And in phase 2, we were able to create some of the digital resources. We wanted to put everything in one place to remind our participants that we were having our meeting, what we were covering, and just to have everything in one place to remind them, hey, this is how you sign in, this is how we get here. We also created resources of the month to kind of highlight what we would be covering that coming session. And some examples included, guides for sleeping, and all of these resources would be on hyperlinks on our flyer of the month. For phase 3, we were able to evaluate some of the data, and we just wanted to highlight where our folks were coming from. We had a great representation from South America, US, Mexico, and Central America. And when looking at the attendance, we saw a great increase and consistency in the coming months. We did have a drop off in March. We are, thinking that that is probably when spring break was happening and a lot of other holidays were happening in countries of origin. And we just wanted to highlight that overall, the community felt that they were increasing their knowledge of the resources available to them, at least in the online community. And they were also saying that they were feeling that they gained a lot of knowledge on the medical and health conditions that are associated with autism. We did notice that there was some disagreement, and what we wanted to highlight was that we have had some of our professional members from the beginning, so for 3 years, so there may have been overlap in the topics covered in the last 3 years, and that's something that as a team we're taking into consideration as we develop the next year's presentations. When looking at the dissemination of the resources that we have been sharing with the families and with the professionals, we see that more often than not that they are sharing the materials. And when we were looking at the differences between the family members and the professionals, we did see that professionals were more likely to share the resources and the materials that we provided during our sessions. And we really wanted to discuss that a little bit more with Isabel, but to get us going, we wanted to make certain that we highlight that there is still a lot of stigma surrounding the diagnosis of autism and nationally. And when we're looking at Latin American countries too, there is a great stigma around that and not as many resources in our conversations with our participants. So we do have to be very mindful of, while we see that they're using the resources, they're just not sharing within their community. It seems that professionals, being the professionals, feel more confident and able to share that information with their community. An example would be that one of our participants in Monterrey, Mexico, was able to use some of the guides for better sleep hygiene with one of our patients, and she explained that she would probably continue to use those resources with her patients.
As a summary of what my partners have said, ECHO Autismo has expanded their impact in the US, in addition to South America and Mexico. Most of the members reported that they gain knowledge in every session in autism-related topics, in comorbid mental health and medical conditions associated with autism, and the online resources were effective for both population of participants. It was very interesting to note that professionals were more likely to share resources than families. Also that their knowledge of community resources for autism has increased. Members plan to continue attending the future to ECHO sessions, and most of the members share positive experience about the use of resources in their practices. Finally, we want to thoroughly thank you to all the ECHO Autismo team, also to the LEND program faculty and the team here. We want to really thank you to all of them, especially to Dr. Viviana Restrepo, who was always willing to guide us and support us every step of the way. So thank you very much.
So I guess this is just kind of a general question. I mean, obviously our ECHO has not been implemented for all that long. And so we're really looking at short-term effects on kind of the practices of people who are involved. As you were doing research more broadly, are there studies that have looked to see if there are kind of long-term, kind of lasting consequences of this, or is this something that fades, like unfortunately many interventions do? Do we know that?
We don't know that currently. What we are seeing between our ECHO Autismo and the ECHO Autism hubs programs here at the Mind is that we typically do see a trend of about 50% of our initial participants will drop off, and then keeping those folks.
Mm-hmm.
The other half is variable, and that's why we were trying to see, if we kind of change up how we're reminding folks of our sessions, would that change? We did see that in the greater literature. It's still emerging, especially with the confounds of COVID and how every country is dealing with that. At least with the quick review that I did, we see that those that maintain, of course, are benefiting, but to keep that attrition down, that is still a challenge that folks are researching. So sorry, I couldn't quite answer the question, but
that's very helpful. Thank you. I really appreciate it.
You're welcome.
Thank you for the presentation. I had a question about the dissemination data that you were sharing, that looked like professionals tended to disseminate the information more than family members. And I'm just curious, I think an example you gave was that a professional shared it with one of their patients. And so I'm wondering if that question was asked, like who they disseminated to. And I'm wondering if that affects maybe some of the data. Like, it would seem that the professionals would be sharing it more regularly with their patients, but who would family members share it with?
So that was a good question, and that was something that we were reflecting on as we were going through the data, that we didn't ask specifically in the surveys, who are you sharing this information with? At least qualitatively in conversation with our participants, their community is their family members and other parents of kids with developmental disabilities. So within their community, we are seeing some sharing, but there's also a lot of pressure and shame and stigma that, we really don't want to talk about this. So we keep it to ourselves. It's useful to us, but in sharing that, then we open the door of like, well, look at us, look at what is going on with our family. And in the literature, at least, it's consistent that with, at least in the Latino community and other minority communities, it's, it's something that, is heavily influenced by culture, by religion. And it seemed that, we don't want to look at someone that has been punished by our creator. So I think a lot of that pressure and a lot of the lack of resources in general, and a lot of the places that we're touching on, it makes it even harder to come out and to share, because there's so little. And I think there's a component, at least in Mexico. I have family in Mexico, so I know a little bit more, at least in my experience, that there's so little available, and so little, there's no funding for kids with autism, and there's no special schools. If you're lucky enough to send your child to school, it's because you have the money for it. Otherwise, you don't have a lot of, I guess, trust in the established systems there. So I think that is also contributing to, well, who's going to believe us that this works? And, there's a bit of learned helplessness, I think, because of the lack of systemization of resources in those countries. Sorry, that's my soapbox. Also, I hope that answers the question a little bit.
Okay, thank you.
Thank you.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.